Hello, my name is Cameron Baker. Euthanasia. You might have heard this word once or twice, but it isn't a common word, and this topic is extremely controversial, and not some topic that I can just put in a few words and call it good. Euthanasia is legal in the state of Missouri and many more states, but should it be that way? Or it's illegal in the state of Missouri and many more states, but should it be that way? The answer is no. To start, let's discuss what euthanasia really is. According to the University of Missouri and the Center of Health Ethics, they say euthanasia is the practice of ending the life of a patient to limit the patient's suffering. The patient in question would typically be terminally ill or experiencing great pain and suffering. So from that, you learn a lot of different things. First is only used on people who are in great pain and suffering. They usually can't move, can't function for themselves, people who are in a vegetative state, people who can't brush their own hair, can't brush their own teeth, people who are just in generally a lot of pain. People who are just elderly and can't even stand, sort of thing. A passage that I read from the National Institute of Health talks about when and what makes a patient ask for euthanasia. Common conditions which make a patient seek euthanasia are terminally ill cancer patients, acquired immune deficiency syndrome, and other terminally ill conditions where there is no active treatment. Factors which are responsible for decision making are classified into physical and physiological factors, or psychological factors. Physical conditions that affect the quality of life in these patients are unbearable pain, nausea, vomiting, difficulty in swallowing, paralysis, and breathlessness. Psychological factors include depression, feeling like a burden, feeling of a loss, feeling loss of control and dignity, and dislike of being dependent. But some argue that suicidal ideation, care, might also be the underlying reasons for seeking euthanasia. So that sort of sums up why people resort to euthanasia. A man named Jack Kevorkian was a giant proponent to the right of euthanasia. He was a doctor, and he personally performed the act of euthanasia on many people, putting elderly out of their suffering. He got many sad letters from people asking for help, saying that the terminal illnesses aren't bearable anymore. A letter from a nice lady named Sherry Miller that was written to Dr. Kevorkian said, "Dear Dr. Kevorkian, help. I am a 41-year-old victim of MS. I can no longer take care of myself. Being of sound mind, I wish to end my life peacefully. I know I will only get worse. Please help me, Sherry Miller." Another letter he received from another lady named Carol Loving wrote, "Dear Dr. Kevorkian, my son is dying of Lou Gehrig's disease. He would like your help to leave this world and to free his soul to everlasting life. Sincerely, Carol Loving." Since sadly, he received many of these letters, and just like these, he had helped so many people from suffering. Jack Kevorkian sadly passed away in 2011 after fighting a long life of trying to make euthanasia legal in the United States. He tried very hard and didn't get very far. To dive deeper into what euthanasia is, there are many different types of euthanasia. Not substance types, but more so how euthanasia is used. Before researching this topic, I did think that it was a substance. Still, no is more than an action rather than a substance. When they act on euthanasia, they use a substance to kill the patient who is suffering, and there are many different types of substances they use. I read a passage from the National Institutes of Health, and they say, in the process of euthanasia, practitioners commonly use or administrate a general anesthetic. First, frequently a barbiturate or another sedative, such as propofol, which seeks to induce unconsciousness. Something that pretty much explains that typically when they try to make it as painless as possible, the only goal is to get rid of the amount of suffering you are going through. Now there's a voluntary euthanasia, which is found when a competent person makes a voluntary request to be helped pass away. Or in simpler terms, they ask to die because they don't want to suffer anymore, and they already do suffer most of the time. When this happens, they can speak or use some part of their brain to make this request. Another example of euthanasia is involuntary euthanasia. This was sadly when someone kills a patient without the patient's knowledge or consent, which is very illegal and not allowed in any of the 50 states. In this situation, the patient is saying no, and someone decides to do it instead, which in every situation should not be legal. And this procedure and I'm not pushing for this procedure to be legal. PSA, otherwise known as physician-assisted suicide, is whenever a doctor knowingly helps the patient to end their life. This is what Jack Kevorkian did and was trying to make legal. This patient was most likely going through much and can't physically live any longer. There are many other variations and different ways to use the solution, but we are mainly focusing on the way called mercy killing, or just the general term of euthanasia. This comes sort of between involuntary and voluntary, kind of in a way. The definition of this term, according to the National Cancer Institute, states that an easy or painless death, or the intentional ending of the life or a person suffering from an incurable or painless disease. So in the quote, they use the word intentional, which is a good way of describing mercy killing in a way. So in a little bit more detail, mercy killing is when a doctor or a family decides to end the patient's life, to end the patient's suffering, by giving them a substance that will end their suffering and put them out of their misery. Now think about it. According to the law, most states in the United States, putting someone out of their misery is illegal. And it is legal in some foreign countries. World Confederation, or Right to Die Society, says in Belgium and the Netherlands, only physicians are allowed to assist people to die. In Switzerland, however, assistance is provided by the non-physicians who work within the guidelines of Swiss law. These non-physicians include the Right to Die societies such as Exit or Desuche Schwitz. In Switzerland, Exit Desuche Schwitz accepts people to die without any special law. Jurisdiction or government regulations on the topic, the actions Exit are tolerated by the government but watched very carefully. Now, there are two ways you can view this. The first is, imagine someone you love very, very much was getting old, so they couldn't move or get out of their chair, they can't walk, they can't talk, and they're just really in a vegetative state. Now, this would be so hard on them, but you wouldn't let her lose them or let them suffer. Or, instead of making them suffer, you could look at it the way that most people should. Imagine you are that loved one who cannot walk, who cannot talk, and who cannot go through that. Now you have a selfish family member keeping you alive and letting you suffer because they can't lose you. So, no, hopefully you would never want that for yourself or anyone else. So I think euthanasia should be legal and protect the rights of people who are suffering and cannot function. Thank you.